Hey, this is Chris, keeping it real, facts over fear. How are you? Time for the weekly COVID-19 North Carolina herd immunity comprehensive report. I could make that title longer, I guess, if I wanted to. Once again, in the notes, all data in charts is a 14-day rolling average. North Carolina Department of Health and Human Services, as I noted last week, which is what this notice from, started reporting deaths by the date of death rather than the date it was reported, and so the charts reflect that. The overall death rate has steadied at 0.8%, which is very good news. If you remember back in the spring, people were citing figures like 3, 4, 5%. And this is the official death figure from official cases, and so the likely real death rate is much lower, but I've pretty much given up on likely number of cases at this point because I just don't know anymore. Cases are way up, as you can see by this graph. The cases have accelerated significantly. That's why that curve is curving down to more towards the left rather than towards the right. We have had 42,000 reported cases in the last 7 days in North Carolina. That is approximately 10% of the total number of cases. So that is significant. The vaccines did begin rolling out last week. Pfizer and Moderna. Moderna was approved by the FDA on an emergency basis this past week. So we will see a lot of vaccines being shipped out. The AstraZeneca vaccine is on the cusp of, from what I understand, from what I see on YouTube, from sources I respect, is on the cusp of being approved in the UK, which means that approval in the US cannot be too far behind. AstraZeneca had some reporting problems and a couple of adverse reactions in their study group, and so that has slowed down their rollout of the vaccine. So we just take a look at the graphs real quick. We can see that the curve is steepening, which means there's more cases. The new herd immunity date is 3/28, which is a week sooner than last week's forecast. I don't put any stock in that. I'm just saying that is the trend. It looks as though the case report on a 14-day rolling average has finally reached a peak. I hope it has. I kind of got fooled last week, or maybe it was the week before last, thinking that was going to happen, but it instead accelerated even more. But now we've seen in this little area the last few days, the 14-day rolling average is starting to flatten. I hope that is true, but we'll just have to see. Deaths per case, of course, this contains data that is by the death reporting, the actual death date, rather than the reported death date. And so, of course, this graph is only good till about here, and so it seems to have leveled off at just right around 0.8%, which is, like I said earlier, is good. The main drivers of this pandemic are social mobility and indoor spaces. And so what I mean by social mobility, I mean people getting together with people that they don't normally travel in the circles of. And so for example, in your daily life, you go to the grocery store, you see the same people. You go to the drugstore, you see the same people. You live in a household and you see the same people. What's happening is that these circles are being ever expanded, and so you're seeing people you don't normally see, and you are meeting people you don't normally meet. And so that's what I mean by social mobility. And of course, Thanksgiving epitomized that, but I don't think Thanksgiving was the really like a critical main driver of this. I just think as people are just in general getting together and being exposed to people that they don't normally see. And of course, indoor spaces, um, you know, a typical house is a a breeding ground. Well, it's not a breeding ground. I mean, it's just a place where the virus naturally collects in the air, because we know that over the past 10 or 20 or 30 years, there's been a drive to make houses more energy efficient, and that means letting less outside air in and making it harder for inside air to get out. And so that's what's going on. My construction background tells me that that is an absolute fact, and so that's the way it goes. Basically, a house just recirculates the inside air over and over and over again, and there is some leakage from the outside and some from the inside to the outside, but it's rather a lot less than it was 50 years ago. So there is no effective means of slowing this virus down. I mean, there's things we can do to chip away around the edges. You know, we can keep our social distance, we can wear masks, but nothing that we've come up with other than a total ironclad lockdown will change the trajectory of this virus. And that's just the way it is. So the outlook is, I've already gone over the new herd immunity date. Deaths have risen to about 40 on a 14-day rolling average, but that's to be expected given the significant rise in cases. I do expect the deaths per case to remain consistent, and from here on out, I don't see a reason why we should see, for example, like we see in this chart, back in April and May in North Carolina, a death rate of 6%. We are not going to go back to that territory, which leads me back into my next point. Oh, wow. Oh, yes. We are fortunate that this virus started when it did. Can you imagine if this virus had started in September or October, when people were getting inside and doing what they were going to do? This thing would have exploded like there was no tomorrow. There would have been, well, look, we'd be where we are right now, except there'd be a lot more people who were dead, because the hospitals would have absolutely been overrun and overwhelmed, and we would be in true emergency territory. So the fact that this virus arrived in the United States in January, and we did have that big spike, but the big spike wasn't like the total number of cases back in February, March, and April were not nearly what we're getting now. If we had a 6% death rate now, we would be facing societal chaos. Instead, it's just something that I think everyone can kind of deal with. And so we were fortunate that this virus started when it did. I think that's about it for this page, right? Okay, let's go to the next page, hospitalizations. I don't really have a lot to say about hospitalizations. I'm not, the admissions to discharge ratio has leveled off and seems to be going down. So that's what this graph indicates. And so it looks like really, for about the past month and a half or so, this level of admissions to discharges has been level. Now it's been high. 1.08, 1.09, 1.10. Now it's dropped down a little bit, but that's good, because that means that a lot more people are getting out being discharged for. They're being discharged for the number of admissions. So the AD ratio seems to have peaked. It could be because the graph on the previous page, which showed the number of North Carolinians who had COVID-19, has gone up so much. I don't know. I post these charts with predictions when we're going to reach herd immunity. I don't really have any real confidence in them, because I don't have access to any real data. The data I have relied on in the past has proved to be somewhat problematic, and so it's like, join the club. I'm just another guy trying to predict something with completely limited information. Excuse me. The ICU bed situation is still concerning. It still continues. Hold on. Let me get down here. Yes, it's still on the upswing, and the curve says it's still moderately increasing. And so, ICU beds are one of those things you just can't manufacture a bunch of staffed ICU beds. You can manufacture ICU beds all day long, but where's the staff that's going to take care of those beds? That's the deal. Still, looking at this graph, I'm looking at admissions compared to discharges. I'm seeing that those two are slightly starting to meet, and so I do expect discharges to meet admissions in the next few weeks. So I really do hope that happens, because then hospitals can expect to see a decreasing patient load, and I really do hope we see that. But I am in no way predicting anything anymore. Hospital. Let me see what we got here. Hospitalizations is partly a matter of record keeping. I have been of the opinion that it was all a matter of record keeping. Now I think it's partly a matter of it, and I think it's partly a matter of just, I don't know what it is a part of, to tell you the truth. The cynical side of me says, I want to think that they're just misclassifying patients. The other part of me, which is probably the more realistic part, says, well, they're shuffling these beds around, and they're trying to do the best that they can. And I think, if I'm going to give the North Carolina Department of Health and Human Services a break, this is the area I'm going to give them a break in, because I think their overall coordination of hospital beds has been pretty good. Not knowing all the facts, I'm gonna give them that benefit of the doubt. I don't know if they're keeping people out of the hospital who need to be in. I don't think that would be the case. I think if you need hospitalization in North Carolina today, if you're on the margins, you don't get into the hospital, and I just think that's kind of a fact of life. But that doesn't mean that you can't receive adequate care, and it doesn't mean you're not going to be okay. I think the criteria probably have gone up for admissions. Again, not that that's necessarily a bad thing. It's just like, well, maybe we should always do things that way, right? Again, with the lack of really good information, it's hard to say. So I'm just going to err on the side of caution and say, hey, I think everybody's in the hospital system in North Carolina is doing a pretty good job. So the outlook is total bed usage will remain high, but hopefully bed usage has peaked. Christmas will tell the story, and it's just like, well, it's just another big holiday. Going back to previous parts of this video, have the most pertinent question is, has the population of North Carolina mixed sufficiently to really totally show the expression of this virus? And that's what we're going to find out. And I keep being surprised that there's so many people who are available to get this virus. That is the conundrum here, right? Have we actually reached a peak here? I mean, was Thanksgiving and all the other intermixing that's gone on since it's gotten colder outside, have we finally reached that point, or is it just or are the official numbers real and there's still 10 million people to go through? That is the great unknown of this equation, and yet we'll find out one way or another. And I really do hope that we have reached that peak, but I'm just a guy, right? Okay. If you have any questions or comments, leave them in the section below. It's kind of goes back to my video on realism and humility. I've learned a lot. Just because I can make a stupid Excel spreadsheet with some graphs on it doesn't mean I know anything, right? Like and subscribe. We appreciate when you do, and we will see you on the next. Well, I would say fact-filled. This is just we're just kind of guessing right now, right? Alrighty. We'll see you on the next video. Thank you so much for watching. I appreciate it.